I'm going to be performing an extraoral visual and tactile oral cancer screening on my husband, James. Typically, before an extraoral assessment, I would have the patient complete a medical history form and ask questions about alcohol and tobacco use. I would also ask about persistent ear pain, difficulty swallowing, persistent hoarseness, or a change in his voice. So before performing the palpations, I'm going to give him a general visual exam of his head, neck, and face and skin to check for any variations in color, contour, consistency, or function. And any variations from normal should be noted or even measured by a probe if possible. Okay. Now I will bilaterally palpate the forehead and the frontal sinuses. I'm doing this by using circular compressing motions all along his forehead. And down the temporomandibular joint. And next I will inspect the entire scalp, especially around the hairline, starting from one ear and proceed to the other ear. This is to check for any debris or any lesions or anything that would be considered abnormal. Now I'm going to have him bend his head forward and bilaterally palpate the occipital nodes on each side of the base of his head. And I'm going to work my way toward the external ear, as well as the face and auricle nodes. Next, I will visually inspect and bilaterally palpate the external nose, starting at the root and working my way down to the apex. And next, I will inspect and bilaterally palpate each side of the face and facial nodes, starting at the infraorbital region to the labial commissures. And then to the surface of the mandible. And bilaterally palpate the maxillary sinuses. I will also assess the masseter muscle and the parotid gland by bilaterally starting at the front of each ear and move toward the cheek area and down the angle of the mandible. I'm going to have you clench your teeth so that I can feel your parotid gland. Starting at the front of the ear. And work down the angle of the mandible. And now I will palpate the submental and submandibular nodes. I'm going to be sure to press firmly against any bony structures so I can feel any detectable or large nodes. And also I'm comparing the right and left sides. Also, I'm going to check the sublingual glands. I will have him to lift his tongue to the roof of his mouth so that I can detect any lymph nodes. Now to assess the TMJ, I will gently place my fingers into the outer part of the external acoustic meatus and ask if he feels any pain when opening and closing. So I'm going to have you open and closing your mouth. I'm going to have you to do that several times so that I can listen for any joints, any sounds that would be made by the joint. And then shift your jaw from right to left. Do you feel any pain or discomfort when doing that? Okay. Next, I will use both hands to palpate each side of the neck, including the sternocleidomastoid muscle and the associated nodes. I'm going to have him turn his head and lower his chin. This helps to protrude the sternocleidomastoid muscle. And while in this position, I will check the anterior and posterior cervical chain of lymph nodes. I'm going to do the other side. I will also bilaterally palpate the supraclavicular nodes. Now I will begin the thyroid assessment by placing my hands on each side of the trachea, and I will slightly displace the trachea with gentle digital palpations. There should be no nodules or masses in this area. And I will now have him to swallow so I can visually assess and palpate the larynx to check for mobility. Go ahead and swallow. And this concludes the extraoral exam.